Welcome to Health Center. I'm Dr. Monica Sweeney here at SUNY Downstate. Today my guest is Dr. Jamila Youssef, who is the medical director of Star Clinic. Thank you for being here, Dr. Youssef. I am interested first in knowing where we are in this epidemic that's been going on for 35 years.
Thank you, Dr. Sweeney. Thank you for having me here. Currently in the United States, we have 1.2 million individuals living with HIV/AIDS. Over the years, since 2005, we've seen a decrease in the number of infections. In 2014, we had approximately 44,000 new cases of HIV.
That's new diagnosis.
New diagnosis, correct. And we are seeing a decrease in the mortality. But we are still seeing increases in high-risk groups, such as men who have sex with men, who I also may refer to as MSM.
The thing is that you say high-risk groups, and we always use that term. People who get infected, though, it is not the group to which they belong as much as the behaviors in which they engage. Is that correct?
You are correct.
So would you talk about the risk groups, please, instead of just all the risk groups that are infected or have a high infection rate?
The risk groups are individuals who engage in unprotected sex.
Anybody who engage in...
Anybody, whether it's straight couples or couples of the same sexual orientation.
What about older people? Because I know that many clinicians don't even ask people over 50 or 55 about their risk. What about older people? Are they getting infected?
We're absolutely seeing higher numbers in older individuals. People are getting diagnosed later on with HIV. Their behavior hasn't changed. They're still sexually active. And providers, as you pointed out, forget to ask that important question.
And, you know, when I used to talk to people, I would say, don't say active, because one of my patients said to me, I'm not that active, I only have sex 3 times a week. So we have to ask them whether they're still having sex. What about drug use as a risk factor now?
Drug use has been less of a risk factor these days. It's accounting for about 6% of infections overall. It's come down, but it is still a risk factor for certain groups. In some areas in New York City, IV drug use is actually one of the more prominent ways that individuals are contracting HIV.
So 35 years, we're still getting 44,000 new cases a year that become diagnosed. What is it that we can do? Because I like to talk about how we can change this dynamic. It is getting better. We know that it used to be 50,000.
Yes.
Now it's
in the mid-40s, 44,000.
In the 45,000. So we know that it's going down gradually. What are the things that people can do other than protection when they're having sex? Would you list those right up front?
So you mentioned one, which is protection during sex. If someone engages in IV drug use, there is harm reduction, needle exchange. But I think the biggest new prevention modality that we have recently has been the concept of PrEP, which is called pre-exposure prophylaxis.
Would you explain pre-exposure prophylaxis for those who are not familiar with those terms?
Yes. So this is where someone who's HIV negative can take HIV medications in order to prevent themselves from acquiring HIV. It's typically done if someone is in a relationship with someone who is HIV positive. So what we call a serodiscordant couple, one positive, one negative, or anyone who is engaging in behavior that puts them at risk for HIV, such as a sex worker, someone actively using IV drugs. Those are some examples.
And it's important to talk about a little bit about how they would take it. They didn't just get up on Saturday and say, I'm going out tonight and have unprotected sex, so let me take a pill. Would you talk a little bit about how one should go about using PrEP?
So in order to go about using PrEP, what's recommended is to see your provider or one of the New York City Department of Health clinics and have a baseline HIV test to make sure that you are HIV negative before starting pre-exposure prophylaxis. And then it is one medication that's given once a day. But it's important for it to work, you must take it every single day.
There are people who say that they don't want to take medications because they are poisons. Could you talk about the effectiveness of PrEP if it's done correctly for those who won't use other ways of staying uninfected?
PrEP has, if it's taken every single day, it has been in the very high 90s in terms of how effective it is at preventing HIV infections. So it is extremely effective. Thinking about the patient commenting about the poison, having HIV can even be worse of a poison in terms of all the ill effects that it can have on one's body. So preventing it with this medication, very well tolerated, minimal side effects, easy to take pill, it really can make a huge difference in the impact of HIV on our society.
Now, let's talk about people who are already infected. How are things going in terms of treatment? I have been involved in HIV from the time that, first of all, there was no treatment, and then there were a handful of pills that people had to take. Some on empty stomach, some on full stomach. What is the treatment like now?
So it's completely different from what it was like back in the mid-90s. Treatment was first developed in 1987 with just AZT. In the mid-90s, we had different classes of medication that worked well, but were lots of pills and lots of side effects. Now we have 6 tablets that are each 1 pill once a day. So 6 different options for a 1 pill combination for individuals. It's well tolerated, minimal side effects, and it's really have revolutionized in terms of how we treat patients these days compared to what we used to do.
Now, when you say 6 pills,
there's different possibilities.
Options, 6 different possibilities.
6 different possibilities.
With taking 1 pill a day. But the caveat is?
It must be taken every single day for it to work and be effective.
And in that 1 pill,
is it one
medication?
There are actually 3 medications in that 1 pill. So it's what we call co-formulated, and these are single tablet regimens is what we call them.
So by taking 1 pill a day, you can stay on top of your IV treatment, your HIV treatment.
Correct.
With 1 pill a day, even though there are 3 medications in it.
That's right.
It's so different from the way it was earlier when you had to figure out before meal, after meal, empty stomach. So it really is relatively easy to stay adherent to your medications. What happens if a person is not adherent to their medication?
They put themselves at risk for developing what we call mutations in the virus, and then as a result, those mutations may accumulate and their medications may not work for them. We do have other treatment options, but it may not be as simple as 1 pill once a day. And unfortunately, as a result, they may acquire other infections along the way as their immune system may worsen.
I'm glad you brought that up. Could you talk a little bit about opportunistic infections? Just a little about, especially for people who are feeling well and think that they don't need to take the medication because they feel well. Talk a little bit about opportunistic infections.
So when one has HIV, there's a lot of HIV virus that's being produced in the body. And this gets into every part of our body, and it can cause effects on us that we might not even feel. Heart problems, kidney problems, memory, rashes, and so forth. And as your immune system decreases, the chance of you getting an opportunistic infection, such as pneumonia, shingles, meningitis, increase, as well as tuberculosis. There's also an association with TB and HIV. So that can happen if your immune system is not under control with the medications.
So what are the programs? Star Clinic has been around since the early days in 1991, is that right?
That's correct.
And you have all kinds of terrific services that are provided in the Star Clinic. Would you talk about those?
Yes. So we have HIV primary care. We treat patients for all their medical conditions, including HIV. We offer substance use treatment, psychiatric services. We have a care coordination program in which we have patient navigators who can help patients remind them of their medications and visit them in their home to help make sure that they are able to take their medications. And we also offer pre-exposure prophylaxis treatment, the PrEP, and post-exposure prophylaxis treatment as well. If someone had an exposure to HIV within a very short period of time, time is of the essence with post-exposure prophylaxis. So within,
do you do 48 or 72 hours?
We do 72 in case the exposure happens on a Friday night and they come Monday morning, but the closest we can get to
when the exposure happens.
Exactly, is ideal. We also offer hepatitis C services for people with HIV and for people without.
You know, I'm glad you brought up post-exposure prophylaxis, because most hospital emergency rooms in New York State, not just New York City, in New York State, are supposed to provide post-exposure prophylaxis. I don't know whether or not that's actually happening at this point. Can you tell me whether or not that is?
That is mandated by New York law. They should be doing that. We know at Downstate that is happening, and we get a referral right away to our clinic.
So for those people who have an exposure during the weekend, they can present themselves to an emergency room, at least in New York City, and they should be able to get post-exposure prophylaxis. Is that correct?
That is correct.
Because the closer you are to the exposure, the better the outcome is.
Absolutely.
That's what they're still saying.
That's what they're still saying. So if you had the exposure, if you know what time it was, then as soon as you can, get to the emergency room, seek medical attention right away so you can get tested and get put on medications as soon as possible.
So you were in the process of listing the programs available in the STAR clinic, and I interrupted you to talk about post-exposure prophylaxis. So if you can just, even if you're saying it twice, it doesn't hurt. Tell me the rest of the programs that you have.
One important program that I should also mention is our LGBT, lesbian, gay, bisexual, transgender health initiative clinic. So in Brooklyn, we're seeing high rates of men who have sex with men and gay men acquiring new infections. It's about 67%.
Did you say 67%?
67% of new infections in Brooklyn are among African American, gay, and men who have sex with men.
So that means for the public, whom everybody may not be fraction literate right this minute, if you took 100 men who became infected with HIV in Brooklyn,
yes,
67 of them would be men who have sex with men.
Exactly.
Whatever they call themselves.
Exactly.
And it is important not to use labels as much as behavior. Is that right?
You're right. We have men who are married and they have sex with other men. So we can't label anybody, just the behavior. And we've opened a clinic that sees exclusively lesbian, gay, bisexual, transgender individuals. We offer also, PrEP and PEP at that clinic, hormone therapy, and
so you help people who are transitioning.
Yes.
Who are doing? You help transgenders who are transitioning from male to female.
Yes.
In your clinic.
We do. We do.
That is absolutely wonderful, and I don't know if the word has gotten out, because that's been an issue for many people in New York City, and not to mention around the country.
Absolutely. And another service I should mention, because it's unique in Brooklyn, is we offer high-resolution endoscopy services. So for our patients, male and female, who have anal dysplasia, so abnormalities that can lead to anal cancer, we offer services that can help identify that and help treat it.
Which is one of the many complications of being infected.
Exactly.
And having anal sex. So one-stop shopping, essentially.
That's right.
And you have mental health services.
Yes.
So the people who are hearing us need to know, if you need services, the STAR Clinic is the place to come if you're in our area. And we will talk later a little bit about some other places that you can get care. Dr. Youssef, thank you so much. It has been such a pleasure having you here. And I might say you've been in the STAR Clinic for how many years?
10 years.
10 years, providing that service with a smile. Thank you very much.
Thank you.
We are here with Mrs. Gloria Guzman. We are very happy to have you here with us today. And I appreciate you coming on the show. You're a patient at STAR Clinic, to share your story. I am going to ask you to share with us whatever you feel comfortable sharing.
Well, first I must say that it's a pleasure to be here, and I feel very honored by being invited here to speak. It's a pleasure to speak about my story, because I feel that my story would inspire someone else that's less fortunate than I, or maybe not seeing what I'm seeing through the life of a person taking medications since they began.
Taking medication for HIV
Yes.
for how long?
Well, I've been positive now 33 years.
33 years?
33 years.
How long have you known that you were infected?
I was diagnosed in the 80s. And back in the days, they didn't have medications. And there was one in the pipeline, which was AZT. And then came along a medication named Hivid. And this is where the beginning of my story begins, on taking medications. You name them, I tried them.
So altogether, you've been taking medication for almost as long as you've been infected.
That is correct.
And here you are.
Yes.
That in itself is a story for the public that will be seeing you to hear, is that you've been on your medications almost over 30 years.
Yes. As long as they've been around, I've been around.
You've been on them.
Yes.
So how did you find out you were infected? What did you do?
Well, I found out through a small bottle of AZT that I found cleaning my closet out. My husband didn't tell me that he had it. And when I found that bottle up high in the closet, I decided to put the bottle on the counter and wait for him to get home. And I asked him, and he actually just told me, and I said, well, we must go to the doctor together. And the doctor actually told him, this is your time and opportunity to tell her what you should have told her a long time ago. And this is how I found out.
You know, it's important, your story is important, and it's something that many people have told me over the years. I wasn't doing anything. I wasn't promiscuous. I didn't do drugs. I was not selling myself. I was not a sex worker. I didn't do anything but have sex with my husband.
That's right.
And I've heard that story many times.
Yes.
So that's a lesson for everybody to know that you have to have conversations with your partner.
Yes.
Everybody needs to have a conversation with their partner.
And especially in the Latino community and like the Flatbush area, there's a lot of cultural, and it's really cultural. There's some marriages and some couples that do not believe in the condom use, protection, mainly the Hispanic, like Mexicans, Ecuadorians.
Well, it's not limited
Yeah,
to the
to-
Spanish
sorry.
community.
Right.
The African diaspora has its share
Exactly.
of people who don't want to use
Don't wanna use
at
condoms.
all and don't want to discuss with their partners.
But the husband goes out and the woman is at home, and this is where HIV enters the home. My case was a little different. My case was my husband had it when he married me, just didn't disclose to me.
So
he was a
married
single-
you already infected.
Yes, he was a single man, and apparently he was in fear of losing me and didn't want to share that secret. I am blessed to say, and I'm happy to say, that my children are from a first marriage, where it gave me joy just to know that my children don't and didn't have to go through what I've been through.
So you two did not have children together.
Never, no.
And so you started your medication over 30 years ago, and today,
I'm still on meds.
still on your meds.
Yes.
Have you ever been off of your medication since you have been, since you've known that you were infected? Have you ever had to stop taking them?
Never. I never did. And the only times that I was off of medication, it would be one day until the new medication would come in, because I did a lot of switching due to major side effects like diarrhea, vomiting, certain side effects that come along with it. But the only one time that I really was without meds for about a week was because I was having bronchial pneumonia.
Was it pneumonia related to HIV?
No, it was just a bronchial cold. It developed a pneumonia, and they had to stop the HIV medication, and that's where you actually would see the drop of the CD4 and the drop of the up of the viral load.
So not only do you have it, you've educated yourself about
Oh
it.
yes.
And you're taking your medications regularly. Have you had any other medical issues since you've been infected other than the bronchial pneumonia, which caused your HIV to get worse temporarily because you were off your meds?
That's correct.
Which is what happens when people stop their medication.
Exactly.
Have you had any other conditions?
Never. I have never been hospitalized. I have never been in the hospital. I've never stayed in a hospital. I've been in good health since, but only because I choose to live it and live it right.
You take it. You take the medicine.
That's right.
Have you shared with your family? Because they say that people who don't share their status with their family are much less likely to be adherent to their medicines. Have you shared your status with your
It
family?
helps. Very therapeutic. My first therapy mentally began when I told my daughters. It felt the load. But I lived in a bubble, I say, a bubble for a while because I did not tell my mother. And I'm going to tell you why. My brother, my only brother, which my mom only had 2 children, we lost him. Back in the days, they call it the full-blown AIDS. And so we lost him. So I really didn't want my mother to actually go through that.
Worry that she was going to lose you.
I kept the secret, yes. Worry that, oh gosh, here's my other child.
Did your mother pass?
My mother passed. And
Did she ever
the
know?
secret kept, no.
She never knew.
Never.
Now, do you ever have another condition that you had to take other medications for? Like hepatitis C, for example?
Yes, in 1998, I come to the doctor, and he tells me, I have good news and bad news for you. And I says, give me the good news first. And he tells me that you're going to be fine. But the bad news is that we found some Hep B.
Hep B or Hep C?
Hep B.
Hep B.
And so there was nothing but a vaccine. They gave me the vaccine. There was no cure yet. And so I went throughout the years with that, and then came the second whammy that I was diagnosed with Hep C. And mentally, I went down mentally.
Well, it's a lot.
Yeah.
HIV, Hep B, and then Hep C.
Yeah. I won't say depressed, but I went mentally in a little quiet tunnel where I just wanted to be by myself and so on. I was scared. I didn't know what Hep B and C meant. But I was offered treatment, which is in 2005. I tried the old method of interferon.
Interferon and ribavirin?
And ribavirin.
Oh, my.
And I did that for 6 months, and it did not work. The side effects were to die for.
Yeah.
Very powerful side effects, and so they had to stop it.
And then what did you do?
Well, around that time, I had lost my only son, 18 years old, on his way to college. Tragic car accident. He died, the young lady died, they all died. And so I didn't have the strength to go back on medication because...
Did you stay on your HIV
Oh,
medicine
yes.
during that period?
I didn't let nothing interfere. But then I started I was treating Dr. Dehan in our clinic, decided that I think it's time that maybe you should try something called Harvoni that just came into the mix.
Well, I want to say in the last minute that we have, I don't want to leave without you showing your photograph, please.
My pleasure. I did poster child.
You did poster child
Oh,
because
yeah.
you are a poster child.
And they named me Wonder Woman.
I want to thank you, Wonder Woman, for being here. It is
my
such
pleasure.
a pleasure to have you on the show.
My
to
pleasure.
be such a role model for the many, many thousands of people
Yes.
that I hope will see you.
Oh,
and I
yes.
hope somebody's going to make a cape for you because you are
Yes.
Wonder Woman.
And it's about strength, staying positive, thinking positive and keeping that in your mind that you're going to be all right.
There you are. You have the last word, Wonder Woman.
Yes.
Thank you, Mrs. Guzman, very much.
My pleasure.
Thank you for watching Health Center. See you next time.